Hi, I'm Lisa Leiter. In Chicago Business Today, hospitals overtime overboard. Overtime at Cook County hospitals is at extraordinary levels, according to an investigation by Crain and the Better Government Assn. A stunning $40 million a year is routinely spent on overtime pay by county hospitals and health clinics, 886,000 hours last year alone. That overtime as a share of total hours is 6.3%, well above the limit recommended by an industry research group to prevent employee fatigue and errors. I sat down with Andy Shaw, President and CEO of the Better Government Assn, to talk more about the story in this week's print edition of Crain's. Andy, thanks for joining us.
My pleasure, Lisa. Nice to be here.
$40 million a year spent on overtime. The county is broke. We've already had major layoffs. What are the major reasons behind all of this money being spent on overtime over the last few years?
If you talk to the nurses and their union, they're going to blame this entire thing on insufficient staffing. And that could easily be part of it. But look, a comparable private hospital, Mercy, which serves a similar type of patient base, indigent patients, spends 1/3 of this amount on overtime. The problem is, even with this new governing commission, which was supposed to clean up the operation of the health and hospital system, the same problem persists. You can only assume that somebody is not managing or supervising properly, or this could be much more under control.
Well, you bring up a really good point, because when this new hospital board was appointed a few years ago, these were the kinds of problems that were supposed to be avoided. Why haven't more nurses been hired?
Todd Stroger and his board raised the sales tax by that penny. It's been rolled back a fraction thus far, 1/4, and it'll be rolled back completely over the next 3 years. But they had plenty of money. They had plenty of money to hire nurses, but I think it's also back to a management issue. When a private hospital only needs 1/3 of this amount of overtime, then somebody's probably not watching the deployment of nurses properly. Let me put this in a context. You could hire 600 additional teachers, 600 additional cops with that $40 million. And so this is money that's not only hurting taxpayers, but it's coming out of another pot that might have provided another essential service beyond health and nurses.
And health is what's at stake here, right? If nurses are working overtime and they're fatigued, 4.9% of total hours paid is what's supposed to be, according to an industry group that we talked to, the right amount of overtime. It's 6.3%.
Right,
so
they're 1.5% above that, and here's the human aspect of this. Nurses who say they're exhausted, who are fighting at home with spouses because they're working too many hours. Here's the risk. You're not doing your job well when you're that tired, and nurses are on the front line of medical care. You could have a terrible foul-up with these many hours, and here's the real nightmare scenario. A patient dies unnecessarily. You have a multi-million-dollar lawsuit on your hands, which jacks that $40 million up and makes it 50 or 60 if it's true negligence. So this is inoperable on all levels, and it's not sustainable, as the Chief of Staff to Tony Preckwinkle, the County Board President, said.
They're promising that they're going to hire more nurses. The nurses say they've heard this before. What kind of changes in addition to that do you think that the county needs to do?
When you look here, it's the same way as you look at streets and sanitation or the transportation department or the highway department. Look at the failure of middle management to properly supervise the workforce. And if you clean that up, I would venture to say you can knock that overtime cost down appreciably without even hiring vast numbers of new nurses. Yes, probably hire some, but you can knock that cost down considerably. It won't waste tax dollars, and it'll leave that money in the taxpayer pot for other critical services like police and school teachers.
Okay, Andy. Well, thanks for joining us today. We appreciate it.
My pleasure.
And that's this edition of Chicago Business Today. You can read more about this story in this week's print edition of Crain's and on chicagobusiness.com. And watch our videos on the go with our new mobile app. You can download it at chicagobusiness.com/mobile apps. Thanks for watching. We'll see you tomorrow.